Since its outbreak in January 2019, SARS-CoV-2 causing COVID-19 disease has to date resulted in over 180,000 cases and 7,000 deaths. While the virus has a higher case fatality rate than many other respiratory viruses, at somewhere between 2 to 3%, many of these deaths are due to overwhelmed healthcare systems that could not cope with the sheer volume of patients they were receiving in a short time period. This was especially problematic in places like Hubei China, Italy, and Iran, whereas in places like South Korea that aggressively enacted quarantine measures, the death rate is significantly lower, at less than 1%. Many places in the world, such as the US, UK, and Australia, are now experiencing community spread of coronavirus. Many estimates indicate that the number of cases will double roughly every 3 days if we do not enact strong suppression strategies. If this was the case, how would Australia cope? Australia currently has around 1,500 ICU beds at its disposal, with the ability to increase that capacity to approximately 4,000 beds. However, if we do not enact any social distancing measures, you can see that the number of COVID-19 cases requiring ICU beds could exceed 35,000 in just 30 days. This would leave us short tens of thousands of ICU beds and result in many more deaths than if we were able to slow the spread and flatten the epidemic curve. Moderate social distancing may reduce the curve somewhat, but only the most extreme social distancing policies have any chance of reducing the caseload to a point where our ICU infrastructure could cope. Similar modelling coming from the UK also seems to support the idea that only the most sweeping measures can reduce the number of coronavirus cases to a point where, in the short term at least, the capacity of our hospitals are not exceeded. With a vaccine and treatment not likely to be available until after the peak of the outbreak, what can we do to protect the people most at risk to coronavirus, such as the elderly and those with other medical conditions, and flatten the curve to preserve the capacity of our hospitals? The best thing we can do on top of maintaining good hygiene is social distancing. Current modelling shows that closing schools and universities, as well as putting any unnecessary social gatherings on hold, even small ones, are the best ways to limit the spread of this disease. This may mean working from home if possible, putting social sports or events like the family barbecue on hold, and generally keeping a safe distance from other people when at all possible. This holds true even if you do not have any symptoms. Current evidence suggests that people become infectious 1 to 2 days before they begin to show any symptoms, as well as some people who never develop symptoms at all. This also includes children. This means you may be infected with coronavirus without even knowing. You may literally save lives by staying at home, even if you feel perfectly well. The fact is that most people who get infected with this virus will be fine. You may feel miserable for a week or so, but you will recover. Many other people, unfortunately though, rely on our hospitals, and we need to do everything we can to flatten the curve so that our healthcare workers can save as many lives as possible.